walked into the cafeteria to see if we could find a hospital employee that could answer our questions. There was a nurse assistant eating by herself. We approached her nicely and asked if she minded asking some of her questions for a communications project for UK healthcare. We know not everyone likes to be bothered while they're on break, but she was very friendly and willing. She was an English African woman in her 20s working as a nurse assistant through UCL.
Hi, I know you're on your lunch break, but I was wondering, we're doing a little communications paper on UK healthcare, and I was wondering if you can ask some questions.
No, not at all. What are your questions?
What does or doesn't free healthcare cover?
It covers everything besides prescription drugs.
So who gets discounts on prescription drugs?
18 and younger get prescription drug discounts, and then so do pregnant women, disabled, and seniors. But when you get assigned a prescription drug from your doctor, there's a thing called the fixed rate, and it's 7 to 13 pounds. And you get the fixed rate if you're prescribed a prescription, but if you're not and you just want that prescription, when going to a pharmacy without your doctor's approval, you won't get the fixed rate of 17 to 13 pounds. You'll have to pay in full.
Okay. How many patients come through about every day? What is the majority rate? Age?
Well, since I work in the women's department, I see women of all ages and only women. But the women that I do see, their ages range from 18 to 80, just depending on like the illness or disease that they're in here for.
How does having less doctors than patients affect the ER? Is it positive or negative?
It would be, I would say, in my own personal opinion, that it's negative having less doctors than patients, because if your doctor can't get you in for an appointment, then you have to go to the waiting room for the ER, which the wait can take up to like 4 hours sometimes. But the hospital does try to prevent that by having their own hotline for patients, so you can call in and ask a nurse or whoever answers the phone how serious, and explain your illness to them, or what if you cut your finger or something like that, how severe, so they can tell you if it's worth coming all the way in to wait in a 4-hour wait or not. So that's something they're trying to do to help prevent waiting for a 4-hour wait.
Thank you very much.
In conclusion to the interview with the nurse, the appropriate way to approach an employee on their break is to be polite and friendly and let them know you don't mean to bother them. This applies to both British and American cultures in a hospital setting. It was clear that our interviewee was comfortable in the setting because she was friendly and extremely willing and understanding while being interviewed. The hospital cafeteria showed aspects of British culture in that people were quiet and kept to themselves, just like they commonly do in other settings. We saw a variety of races and genders in the cafeteria, but mostly middle-aged and senior citizens. In American hospital cafeterias, the setting is more fast-paced and many people like to converse with another, making it a louder environment.
Go.
When in the U.S. going to pick up your prescription, some local pharmacies ask for your home phone number and ID. Walgreens, CVS, Safeway, and Target are some examples of common pharmacies. When picking up your prescriptions, your healthcare covers most of your charges. Sometimes they are due for the prescription. In this scene, we show how in America most pharmacies need you to present your ID and home phone number. And if your healthcare covers your prescription, you don't have to pay for it. This skit is an example of a patient picking up her medicine in America. Jay is playing the patient, Megan is playing the doctor, and Laura is playing the pharmacist. So here is your prescription for your cold. Take it every 4 to 8 hours a week.
Where can I pick up my prescription?
You may go to your local pharmacy to pick it up. Just state your last name and home phone number, and they'll provide you with your medicine.
Will I have to provide my medical card?
No, once you go to your pharmacy, they will only ask you for your ID and your home phone number.
All right, thank you.
Yeah.
Now we're going to go to the pharmacy.
Hello, I need to pick up this prescription. Okay, what is your home phone number and medical card number?
I thought I didn't need my medical card number.
To pick up your prescription from your doctor, you need your medical card number, unless you're picking up a prescription that your healthcare covers.
Here's my ID and home number. I'm only picking up my prescription my healthcare covers.
Alright, here you go. Thank you.
Okay, so this is our conclusion that had to do with our skit on the pharmacist. The way for doctors and patients to interact with each other is to keep formal and informative. The doctor was straightforward with the patient, letting her know exactly what she needed to do to retrieve their medication. The patient followed doctor's instructions, and once at the pharmacy, the procedure went smoothly. Interaction between herself and the pharmacist was similar to the doctor's, in that they both made clear to one another what needed to be done. The overall process was efficient. This is common in American culture because Americans are a time-efficient culture.
To get an English point of view on British healthcare, we interviewed AFS employees. Getting their point of view on healthcare is important because as Americans, we have a different understanding of how the healthcare system works.
Look back.
My name is Annabelle Molina, and I've lived here 23 years. Well, in England, 23 years.
Okay, so we were wondering, what's your opinion on healthcare in the UK?
I like the fact that if I were to need emergency treatment, that I can get it for free. I like the fact that I don't have to pay for an ambulance. What I don't like necessarily is that healthcare is kind of oversaturated. So we have to wait a long time to get seen, and you know the system is kind of breaking because there are so many people and not enough workers. But yeah, I mean, I'm glad. I mean, but obviously we do pay for it. It comes from our taxes because our taxes are crazily high.
Okay. All right. Do you think everyone should have free healthcare?
Yes, I do.
You do?
Yeah, I do. I don't think it's something. I mean, it really depends what you call free, because I mean.
Well, compared to other countries, they don't have healthcare for everyone as you do in the UK.
Right. No, I definitely think you.
So do you think that the UK is right about having it for everyone?
I do. I think it's one of those things that you do need. I think to deny someone that is, I don't know, I don't think it's very loving
Yeah.
or
Okay.
fair.
And then, how does healthcare affect you?
Well, it doesn't really affect me too much now, thankfully, because I'm pretty healthy. But I mean, knock on wood.
Yeah.
You know, if something were to happen, it would affect me. I guess, you know, the only thing is I have like the assurance that if I need it, it's there.
Okay.
That's pretty much it.
Tony Langan. 2 months.
Okay.
3 months.
So what's your opinion on healthcare in the UK, even though that you've only lived here for 2 months?
I think that it's very good in the UK. It's very organised, very well organised, very good.
Okay. Do you think everyone should have free healthcare?
What, in the world or just in?
Well, like in the UK in general, because like as in other countries, like in the US, we don't all have free healthcare as we do here.
I mean, yeah, obviously it'd be good if everyone had free healthcare.
Okay. And then, how does healthcare affect you?
What do you mean? In what ways?
Like, is it?
Do you benefit a lot
Yeah.
from
Do
it?
you benefit?
Does it
from
work for you?
I mean, I haven't got sick that much to benefit. Hopefully I don't benefit from it, and I just don't need it.
Okay.
Yeah.
But, I mean, yeah, it'd be good that if I am sick, it's free.
How was it for you before you came to England?
In Ireland,
Yeah.
you have to pay for it, but it's not that expensive. You just pay if you get sick.
Does
if you go to
everyone have
GP.
to pay for it?
Or you can get insurance, like healthcare insurance, until you're 18, and then after you're 18, you pay for it. So it's not that bad. Or you can get a medical card if you're like on social welfare. Some people can do that. There you go.
Okay.
Claire Gillespie, and I've lived in the UK for 2 years now.
And then, what's your opinion on the healthcare in the UK?
It's very good because it's free and it's available to all.
Okay. And then, do you think everyone should have free healthcare?
Yes.
Why?
Because we're all human beings. And if there's one thing that we all deserve is to be healthy.
Okay. And then, how does healthcare affect you?
Not much because I am never ill and I have never needed to use the healthcare here, but I mean, for example, each time there's a US student who comes here and is ill or who needs emergency treatment, they will have it for free.
How was it before you came here? Like where
It was
from
good.
home?
I lived in France before, and it's the same. You get free healthcare too.
Okay.
My name is Philippa, and I've lived in the UK all of my life, apart from a 7-year stint in Italy.
Okay.
But I'm
Okay. So, what's your opinion on healthcare in the UK?
I think it's great that it's free. I've actually seen quite a lot of changes, I would say, for the worse.
How so?
For example, prescriptions used to be free, they're not free anymore.
Okay.
Dental care used to be free, it's not free anymore. You used to be able to see a doctor at the weekends, which you can't anymore, which I think is having a negative impact on ER emergency care, because people can't see their doctor, so they're going to the ER instead, and the ER is just too busy and can't cope with it.
Can you get insurance like on dental care and stuff, or do you have to pay for it in full?
That's a good question. I'm not sure. to be honest.
Okay.
I was lucky because I managed to get one of the few NHS dentists. I still have to pay, but it's a lot cheaper.
Got you. Okay. And then, do you think everyone should have free healthcare?
Definitely. I think it's a basic human right.
Alrighty. And then, how does the healthcare affect you?
Well, I mean, if I need it, it's free, which is great. It's just trying to see a doctor isn't necessarily that easy because they're only open during the week. Obviously, if you work, that's difficult.
How is it different in Italy? Do you know Italy's healthcare system?
It's very similar. It's free in Italy as well. You do have to pay for prescriptions there, but again, if you're on welfare or benefits, then you don't. So it's very similar.
Okay. Alright. Well, thank you.
It was a comfortable environment because the AIFS employees are people we personally know and connect with. So hearing their personal opinions on free healthcare system gave us an easier understanding of how their healthcare works. Having a casual setting and relationship between all of us made their answers vague and straight to the point. Many of the AIFS members were very quiet and maybe a bit unsure of their answers. Compared to Americans, many interviewees tend to ramble and state many facts. This interview showed how British citizens feel about their free healthcare system. We interviewed one of our American teachers to get an opinion on what healthcare means to her. How long you've lived in the United States?
Colette Harris Matthews. I've lived in the United States for 48 years.
So what's your opinion on the healthcare in the UK or America?
I really don't have an impression of the healthcare system in the United Kingdom. I haven't had to actually utilize it, but I do understand that there is a national healthcare system that people pay taxes into, and then they're able to utilize healthcare, and they've had national healthcare since 1948. So it's a system that is not perfect, but the system, and then the healthcare system in the United States. I've had healthcare my entire life, from since I was a child into adulthood. Well, a couple of years in college I didn't have healthcare, but we were able to use the healthcare system on campus. So I've always had healthcare.
Okay. Do you think everyone should have healthcare in the United States?
I think we have laws that already are in place that we have to give people that go to the emergency room. We have to give healthcare, and we have to give them healthcare. So I think that they need to have some kind of healthcare system for people who are impoverished. Otherwise, what ends up happening is that they use the emergency system for stuff like, I cut my finger, so it's an emergency when you really could have put a Band-Aid on it. I think that in the United States that we need to have a healthcare system that's much more preventative, so that we're dealing with obesity and how people eat, and giving students or kids nutrition classes and healthy eating habits and recess in elementary school, so that they move away from, okay, by the time they're obese, then they already have conditions that are just in the United States getting more of a problem. And it's really an economic issue.
Okay. How does the healthcare in the United States affect you, positively or negatively?
I've always had health care, but I look at the broader perspective of like community college students, but then also like people without health care. And it's not from a socialist point of view, it's more from how can we as the greatest nation, greatest nation on earth, provide healthcare to people where doctors are able to make a sustainable living, and then we're not gouging people who are poor. That we have a healthcare system that really looks at health, your overall health, not just disease. Because when you look at it as a disease, once people have a disease, it's a negative, and the diseases are prevalent, and some of it is our lifestyle, some of it is the way in which we don't have research that we're using to combat certain diseases, and some of it is our mindset about healthcare too. It's from a true Western perspective.
Perfect. Thank
That's
you.
all.
That's it.
Go ahead.
Interviewing Professor Harris Matthews gave us an American perspective on both British and American healthcare. Due to the student-teacher relationship, the conversation was very formal and straightforward. She gave us a thorough, detailed answers and seemed to be very confident in her answers. Whereas when the AIFS employees were answering, they were more reserved and unsure while talking.